Good morning. My name is Maggie Baker, Dean of the School of Nursing and Health Professions at the University of San Francisco, and welcome to our monthly Conversations with the Dean. Yesterday was International Day of Action for Women's Health, and what a great opportunity for us to talk with Dr. Laura Chyu, an assistant professor here in the school who teaches in our public health master's program. Dr. Chyu earned a PhD in public health from the UCLA Fielding School of Public Health, and she also holds a bachelor's degree in human biology and a master's in anthropological sciences, both from Stanford University. As a health demographer, Dr. Chyu's research interest lies in women's health and well-being over the life course, focusing on how social contexts and experiences are embodied physiologically and translate to gendered and social disparities in health. Using data from large population health data sets, she examines the dynamic interplay of biological and social processes at different life stages, including adolescence, the reproductive years, and menopause, and how they link to form health and aging trajectories. It is such a pleasure to have you here with us today.
Thank you, Dean Baker, and hello to everyone on Facebook, faculty, students, and community.
Yeah, great. May I call you Laura?
Absolutely.
Terrific. So Laura, I wanted to talk with you about this fascinating journey you've had that's taking you into this line of research. How did you discover your interest in women's health?
Yeah, so when I was a master's student, I took a class on international women's health, and it was a very kind of formative experience for me because we looked at women's health through a global lens, and I learned about these persistent social and health injustices that women and girls around the world face, including child marriage, female genital mutilation, lack of access to education, lack of access to reproductive health care and family planning. And so that was really stuck with me. And also, this is the first time that I was exposed to looking at health from a life course perspective. So looking at health from the womb to the tomb, so to speak, and all the stages in between, including childhood, adolescence, reproductive years, and menopause. And all of these kind of approaches and frameworks continue to influence my work today.
Yeah, so interesting what gets us sparked off sometimes in a line of research. So tell us a little bit more about your research.
Yeah, so I'm interested in how stress impacts health. And we use the term stress pretty loosely in everyday language and like sort of a catch-all phrase like, I'm really stressed because I have so many deadlines. But stress can actually, acute stress can actually be beneficial and adaptive. The stress that I look at in my research is chronic and toxic stress. So for example, living in poverty or experiencing racism or violence. And so in my research, I look at how these social stressors and exposures get under the skin, so to speak, to impact health at the physiological level. And in particular, I look at allostatic load, which is a measure of cumulative wear and tear on the body due to chronic stress, and is also a predictor for risk for chronic degenerative diseases. And you could think of it kind of like a car engine. So if you were constantly revving this car engine nonstop without any brakes, even when the car's not moving, that's going to result in wear and tear on the engine. And similarly, if someone were to chronically activate their biological stress response, that will result in wear and tear on their neuroendocrine, metabolic, cardiovascular, and immune systems. So I'm interested in looking at patterns of allostatic load in women due to our unique biological makeup, our social experiences, and different responses to stress.
Yeah, that's such important work. Tell us about some of, I know that you've had a lot of important findings, but tell us about a few of them and some directions in which you would like to take your research.
So a major finding would be that this disparity in cumulative wear and tear shows up early in life. such that like women in high-risk groups show signs of earlier aging or weathering. And as women get older, this disparity widens. And so a measure like allostatic load can be very useful in identifying early points of prevention or intervention to reduce that disease burden later in life, and also to reduce health disparities. Some promising areas are, modest changes like increasing physical activity or adopting healthy coping mechanisms for stress. And these modest changes could potentially have a very positive and impactful effect on women's health and aging.
So important. So, speaking about the International Day for Women's Health, what is your vision for women's health?
So what comes to mind is Hillary Clinton's, one of her famous speeches from 1995 at the UN World Congress on Women. And in that speech, she said that human rights are women's rights and women's rights are human rights. And almost 25 years later, I think it still really rings true because women and girls face considerable challenges and obstacles in all sectors of life. So my vision for women's health would be a world in which human rights are respected and protected for women and girls. And I envision a society where that supports women and girls in schools, in the workplace, in politics, in family life, reproductive rights, so that they can thrive and live their healthiest and best lives.
Yeah, that's a great vision. So, what is your advice for the next generation of public health professionals?
So I would say my advice to the next generation, our students, would be to think big and to think outside of silos. The public health challenges of today are very complex and require innovative and interdisciplinary solutions by teams of hardworking people. And our students come from such diverse backgrounds and have just this collective wealth of experience and insight. So I would encourage all our students to really kind of find their strengths and interests and to really expand on those, knowing that they have so much to contribute.
That's terrific. We have so many talented students here, and I'm sure many will be attracted to work with you and with our other faculty members, not just in public health, but in the other health professions we have. And I think that advice around thinking big and thinking outside of silos is really important. So we're almost out of time. I want to thank you for sharing your wonderful work with us today and for inspiring our students. I know that you do that every day, and we are very fortunate to have you as a member of our faculty.
Thank you so much for having me.
Yeah, absolutely. So I want to thank you for watching today's conversation with the Dean. Let us know what you think by adding your comments or liking or sharing this post. And until next time, I wish you a wonderful day. Thank you.